Yes, go. ये गोवर्धन दास जी, unmute yourself. Yeah.
सर ये पॉइंट मैंने पहले भी आपने बताया था एक बार ही।
हाँ.
तो मेरे पास एक सर्वर पेन पेशेंट था विजिट के लिए, तो उनके सर्वर पेन था माइग्रेन टाइप का, बहुत ज्यादा, 5 साल पुराना। उन्होंने हर तरह से इलाज कराया, फिर किसी तरह से पता लगा कि एक्यूप्रेशर की कोई चीज होती है, तो मैं गया वहां पर, तो मैं एक आयुर्वेदिक और टीसीएम कर रहा था। अचानक मुझे आपका जो क्लास थी वो याद आ गई। मैंने क्या आज ये पॉइंट लगाऊंगा, आज मैंने पॉइंट लगाए, ये 500 के 500। उन्होंने तुरंत बोल दिया कि मैंने उनको 40 मिनट लगाया, पूरा 40 मिनट लगा के छोड़ दिया। पहले 8-10 सेकंड छोड़ा मैंने, तो उन्होंने बोला थोड़ा रिलीफ। तो मैंने कहा ठीक है, तो मैंने उनको एक लेफ्ट एयर में लगाया और मैंने 40 मिनट छोड़ दिया। वो एकदम चिकित रह गए कि मेरे को 20% रिलीफ हो गया इस टाइम।
Yeah, so yeah, really this is a very very effective technique. हमने भी कई पेशेंट में देखा है कि हमने तो कैंप्स लगाए हैं, और कैंप में हमने 15-15 लोगों ने पहले एक दूसरे को सिखाया, फिर हमने पेशेंट को ट्रीट किया, सब ठीक हुए। मैंने लगाया या और किसी ने लगाया या उन्होंने किसी ने लगाया, हम किसी ने भी बैटलफील्ड एक्यूपंक्चर लगाया, everyone got benefit during the campings. Thank you so much.
Thank you so much. Thank you so much, sir.
Okay. Yes, Sumul Goik ji, yes, please unmute yourself.
Sir, is the singular gyrus position location the same as endocrine?
No. The endocrine is the inside of the intertragic notch. That's I told you.
Okay.
But this is not the inside. This is the outside.
Outside. Okay, slightly outside.
Yeah.
What about thalamus and hypothalamus? Are they the same place?
The hypothalamus, so thalamus will be in the bottom, and just with the millimeter gap will be hypothalamus.
Above thalamus.
Hypothalamus just will be with the millimeter gap.
Yeah, gap above.
Yeah.
So it's on the wall.
On the wall only. On the wall only. So when we are penetrating so what is happening when we are putting the point on the thalamus, and we are also penetrating the hypothalamus, because the distance between thalamus and hypothalamus is very, very, very minimal.
Go through.
Yeah.
Okay, so it will go through.
Yes, definitely. So when you want to put the thalamus, it will go through from the hypothalamus as well.
Okay, good. Thank you very much, sir.
Welcome. Yes, Salvaji.
In this case, everybody.
Yeah.
Sir, in this case, everybody will get cure, sir, for perfectly, like
Yes. Because see, this is a very, very effective pain management system, because Dr. Richard has developed the system for the warriors in the battlefield.
Okay.
So that without the medicinal use, they can cure the patients with the multiple types of the painful disorder. And we have applied this protocol to on the hundred patients in the many camps, and really the results are awesome. So you can definitely do that.
So this is only for the pain management, or it is including even for the other internal organ diseases, like any ulcer, fatty acid, something like that?
So mainly the battlefield acupuncture, when the name of battlefield comes, we think about the pain management. But I have seen the person also get good sleep when we do this treatment. This also working for the emotional pain or some emotional, like something heaviness. But most of the time we are using this acupuncture system for painful disorders. I would like to tell you one more thing. Salvaji, you have to switch off one device. You are maybe having two devices.
Yeah.
So maybe on the next week, I will tell you like how to treat the emotionally, because on the next week also we have one session that will also be free for all, the session on the NADA, NADA. So that is very good for de-addiction, as well as for all the emotional and psychological pain and uneasiness, insomnia, and even for addiction. Okay. So on the next Monday and Tuesday on the same time also we will be discussing how to treat emotional pain. Just emotional and the inner pain. Okay.
Yes, sir. Sir, when somebody told about this migraine, can you please translate in English, sir, what he said about the migraine points? He said something. He was giving a
that
testimony.
he told he applied this protocol to some. He has seen my previous video, because one of my video on the battlefield acupuncture available in the YouTube. So, and applied to some patients and got very wonderful results. And the patient was so surprised and joyful after getting this treatment.
Yes, sir. Sir, one more last question, sir. Sir, we have been learning so many things, like we have been learning a normal acupuncture, battlefield acupuncture, then TCM we are learning. But when to use what, that is really confusing when it comes to real-time environment, sir. Is there any thing we have to follow, something like that?
See, I cannot tell you that how to do the means when to use auricular, when to use TCM, when to use this, because each and every system is complete and the complete system. So you can use any system which you are learning too deep, and any system, because all system working on the problem. But when we talk about the auricular working for the pain management very fast, for the hormonal problem very fast, for the brain disorders, for the de-addictions, and for the spine problem, we have very good results using auricular, right? So we are already doing, maybe you are already in our auricular acupuncture class, which we are doing Monday, Wednesday, and Friday.
Yeah.
So in that class also, we are going to discuss each and every disease, the treatment of each and every disease, just by using auricular therapy.
Yes, sir.
Just by using auricular therapy. Yeah.
Sir, combination of TCM and auricular, can we use a combination, sir?
Yeah, we can use, but do not apply too many points. And when you are applying the battlefield acupuncture, do not apply the TCM, do not apply the sujok. Don't think that you will apply the points using battlefield, and otherwise the circuit will get disturbed, because we are creating circuit.
Okay, sir.
Okay.
Okay, thank you, sir.
Yeah. Yes, Anuji, Anu, Preeti. Yes.
Hello.
Yes, please.
Sir, can you hear me? Okay.
Yeah.
Sir, for normal knee pain and all, is this thing is battlefield itself enough if they have a arthritis or any knee issues?
See, the thing is this, for the 80% people, it is good and enough. But for the 20% people, we might have to add something more. We have to do that, because in the auricular itself, we have many other points as well. This is very good for the pain and inflammation, even for the acute and the chronic pain. But sometimes we have to take the other points as well. Sometimes we have to add other point as well when we talk about the severe stage of the osteoarthritis. But so if it is the early stage of the osteoarthritis, even the chronic pain, old pain, we can cure with the help of this, and it's working very nicely. Yeah.
So how long should we use this for a knee pain?
So suppose you are you are using the battlefield acupuncture, then you can give 5 sittings every day. Then you can give next 5 sittings alternately. Then you can give the next 5 sittings once a week or twice a week. In that way you can go. So decrease the treatment frequency slowly and slowly. If you are giving the same treatment every day and day by day and 15 days, 1 month, then the effectiveness will reduce. Suppose after giving the 10 to 15 session, patient is telling you, I'm feeling much relief, maybe 40%, maybe 80%. Even after that, give the 7-8 days break, then restart the treatment. Okay, then body will respond very nicely. So the any treatment we can give for longer duration, but with the intermittent gaps.
Okay. So can we add some more points, like for back pain, the lumbar area?
In the battlefield acupuncture, whatever you are thinking, we have tried everything in that condition. Effectiveness is reducing. Because battlefield acupuncture is the complete package. In that we have taken
only these 5 points.
We are taking the point of the back pain, spine, but we already taken the omega-2 working for all the bones.
Okay.
So why we are adding more point? Because we are not confident in our treatment. We are thinking, oh, we have added 5 points, but definitely the pain, how the pain will go with the 5 points, we are not having any confidence. So then we are using, use 3-4 more points. The battlefield acupuncture itself is enough and complete. If you want to use other point, okay, use in the separate time. Maybe today you give battlefield, and next day you can give some other point. But do not do too much hodgepodge and combinations.
Okay. So while using battlefield, only these 5 points.
Yes.
Okay.
But many
Thank-
times, what is the thing? Our human mind is very crazy. Even I am using sometimes sixth point, some sixth point. Yeah, because oh, shall I? Let me add one more point of the knee. I'm using that. Okay, even we are getting the results. But if I'm not using the knee point, even we are getting the result. Then why to use extra point? Why to use extra? Why to give extra needle? Why to give extra pain? Like that.
Okay. Okay, sir. Thank you.
Welcome. Okay, Dr. Jimam Ansari ji. Dr. Jimam Ansari ji. Yes, please. Yeah.
Hello, sir.
Hello.
Sir, is it helpful in angina pain?
Yeah, definitely. Like when we talk about the cardiac disorder, that time it will be helpful because we are using the cingulate gyrus thalamus. And when we talk about the thalamus is very good for this types of the stimulus pain, because the thalamus means all the pain stimulus, whether coming from the heart or coming from the lower back. So on all the pain stimulus, we can use it even for the angina pain. Yes.
Thank you.
Yeah. Parminder Singh ji, yes, please.
सर
Yes, please.
सर पेन का एक पर्पस भी होता है, जैसे किसी को स्वेलिंग हुई पड़ी है
हाँ।
जॉइंट के अंदर या उसको मोच आ गई है, तो पेन उसको फर्दर डैमेज होने से रोकता है।
हाँ।
तो अगर हम इस तरह से ट्रीटमेंट करते हैं और पेन खत्म हो जाता है, तो वो फिर डैमेज होगा फर्दर, उसका वो ट्रीटमेंट तो एग्जैक्ट होगा नहीं इमीडिएटली।
क्या होता है कि जैसे, हाँ, मैं आपकी बात समझ रहा हूँ। क्या होता है कि जैसे हम
डॉक्टर टाइम चाहिए ना।
हाँ, मैं समझ गया आपकी बात। आप ये कहना चाहते हैं कि पेन हमारा फ्रेंड है, तो पेन को रहने दो, पेन हमें मैसेज देगा, तो क्यों पेन को हटाना, है ना? पेन को क्यों हटाना, पेन को बना रहने दो। जब प्रॉब्लम कम हो जाएगी तो पेन अपने आप कम हो जाएगा। आप ये कहना चाहते हैं, मैं आपकी बात समझ गया हूँ। जैसे पेन भी हमारा फ्रेंड है, फीवर भी हमारा फ्रेंड है, हमारे शरीर में जितने भी चीजें पैदा होती हैं वो सब हमारी फ्रेंड है, ऐसे कहने को। अब हम बात आते हैं अगली बात पर कि जब हम डॉक्टर के पास जाते हैं, डॉक्टर साहब बैक पेन है, तो सबसे पहले डॉक्टर आपको एक पेन किलर दवाई देते हैं जो हमारे लिए बहुत हानिकारक होती है, वो भी हम जानते हैं। अच्छा, हमारे पास एक पेशेंट आया, उसने कहा कि कमर में दर्द है, हमने एक निडल लगाई, उसका कमर का दर्द चला गया, तो पेशेंट के अंदर हमारी रैपो डेवलप हो जाती है, वाह कि इन्होंने एक निडल लगाई, हमारा पेन चला गया। ठीक है, तो रैपो बनाने के लिए पेन कम करना जरूरी होता है। अब बात आती है कि जब हम बैटलफील्ड एक्यूपंक्चर करते हैं तो वो इन्फ्लेमेशन को ठीक करता है। अब इन्फ्लेमेशन का मतलब समझिए, इन्फ्लेमेशन में पेन आता है, स्वेलिंग आती है, वहां पर होने वाली अनवांटेड जो गैदरिंग आती है, क्योंकि इन्फ्लेमेशन को ठीक करना, इन्फ्लेमेशन का मतलब है कि रेडनेस, स्वेलिंग, पेन, ईडिमा सब कुछ आ गया उसमें, वहां पर वो सब कुछ आ गया, उसको कम करता है बैटलफील्ड एक्यूपंक्चर। जैसे किसी को कमर में स्प्रेन आया, अब कमर में स्प्रेन आया तो उसको वहां पर सूजन आई, रेडनेस आई और पेन आया, तो अभी सबसे पहले तो हमें सूजन, रेडनेस और पेन को कम करना है, तो जैसे यानी इन्फ्लेमेशन को कम करना है, तो बैटलफील्ड कम कर देगा। तो इन्फ्लेमेशन भी दूर करना हमारे जो सिस्टम का एक पार्ट है। ओके, तो हम एलोपैथी की गोली की तरह काम नहीं कर रहे हैं कि बस दर्द तो है लेकिन ब्रेन को पता नहीं चलेगा, ऐसा नहीं कर रहे हैं। हम उस इन्फ्लेमेशन को ही कम कर रहे हैं, उस सूजन को ही कम कर रहे हैं, जहां पर है ना, वहीं पर काम कर रहे हैं, लेकिन हम उस कॉम्बिनेशन को बना के कर रहे हैं, जो हमारे 5 पॉइंट्स का कॉम्बिनेशन है, हम उसकी मदद से उसको कर पा रहे हैं जी। तो हम कर सकते हैं इसको, और इसमें कोई भी नुकसान नहीं होता, मतलब हमने देखा है देयर इज नो एनी प्रॉब्लम इफ वी reduce the inflammation using battlefield acupuncture. Yes. सागरी जी, yes please, सागरी राघवन जी। हाँ, बोलिए बोलिए।
5-7 दिन दे सकते हैं या दिन में 2 बार भी दे सकते हैं एक्सट्रीम पेन में?
हाँ, हम अगर एक्सट्रीम पेन हो तो आप 2 बार भी दे सकते हो, और जिन लोगों को निडल लगाने में डर लगता है वो लोग सीड लगा के 7 दिन के लिए भी छोड़ सकते हैं। सीड लगा दिए, 7 दिन छोड़ दिया लगाकर, जो ये हमारे सीड्स होते हैं, इनको लगा के छोड़ दिया। ठीक है जी जी, ये सागरी जी प्लीज।
Sir, can we use methi also in case we don't have the seeds?
Yes, definitely we can use.
And you mentioned leaving it for 7 days.
Yeah,
So would that constitute one treatment?
No, we cannot put methi for 7 days.
Okay.
We can put the seed for 7 days because the seeds are dead seeds.
Okay.
Methi is live. So
Okay.
Methi is live. So Methi will absorb the negative energies for maximum 12 hours. Then we have to remove definitely. If we are not removing the Methi or we are not removing the fenugreek, we are not removing fenugreek seeds after the 12 hours. So first it will absorb the negativity, and after that it will send back the negativity. And if we are not really releasing the Methi in 3 days, so it might sprout here. It might sprout because it will absorb the moisture of the human body and there will be sprouting. Okay. If you
No,
want to sprout, then you can put for 7 days.
No, sir, for 5 days, then we put the methi seed and remove, like, as you said, after maybe
No,
8
if you
and
want to put the Methi seeds, then put new seeds every day.
every day.
For
And
only 6 hours enough. That is enough.
6 hours, and we continue with the same treatment, 5 days, then alternate days, then like that.
Yeah, yes.
And every time we follow this thing about how they get relief. So, you mentioned right and left side of the ear.
Yeah, so what is happening? There are a few more things which I will discuss tomorrow, but you're asking, so I will tell you, many patients are very slow responding. Okay, so slow responding means you will see, okay, how you're feeling, patient is not responding because patient have very deep belief how you can cure with 1 or 2 points. So even he is getting good relief in the pain, but psychologically he's not agree that the patient might get relief with 1 or 2 seeds or needle in the ear. So many times we are asking, okay, how you are feeling? No relief. How you are feeling? No relief. Then we are putting all the 10 points, 5 points in the right ear, 5 points in the left ear. Okay, now. So after 10 minutes, patient is telling, yeah, I'm feeling better. In that way. But as per the concept of the Battlefield, if patient is good responding and telling you, I'm feeling relief after you have put the seeds in the right ear, then better put all the remaining point in the right ear only. Do not touch the other ear.
No, what I meant was, sir, one day we have given treatment only in right ear.
Yeah.
So next day when we start,
No.
Do the treatment again, then do we put in the right ear only, or do we again ask which ear is giving relief?
We have to again ask.
So it's like starting fresh every day.
Yeah, every day. We have to start fresh. Yeah.
Thank you.
Every time there is a new session. Every time. Yeah.
Thank you, sir.
Welcome. Kamal Bensit ji. Yes, Kamal ji.
Hi,
Kamal.
Good evening, everyone. Okay, just a very one question here. These classes of Battlefield, is it? Can you hear me?
Yeah, I can hear you. Yeah.
Okay. So, how many classes we have to go through to finish the course? How long it takes?
Only Battlefield?
Yes.
Okay, so how many days we have to give the treatment to the patient, or you're asking how many days I will take to finish this class?
Yeah, how many classes? Yes.
So Battlefield today and tomorrow.
Okay, it's a short course, really.
Yeah, if we see we will feel that still we need, then I will announce tomorrow. But we'll see if all of you are comfortable and confident, then till tomorrow. If I feel that still you are not confident, then we will, or I will also tell you what to do now.
So basically, this class is just for pain, sort of pain and information and what have you.
Yes,
that's it. It's not addressing other things. Like
no, most of the time we are using this only for pain. Whether you are having pain because of the acute problem or the chronic problem, new pain, old pain, arthritis pain, joint pain, any pain. If the pain is there, then we can use it.
Yeah, you can imagine Battlefield. I mean, this is
you start Battlefield, and Battlefield is very easy because you don't have to think, okay, why the pain is there, what is the reason of the pain, what is the diagnosis. Just put the 5 point.
The whole book is written about this, you know.
Yeah, I know.
The whole book was written about this.
Yes.
Anyway, thank you so much for that, and hopefully we'll finish off the. Thank you so much.
Welcome. Yeah.
Bye.
Okay. Yeah. Okay. Dr. Ramkishan Tiwari ji, yes, please.
सर नमस्कार, जैसे कि अभी आपने बताया सर सेंगुलेट, उसके बाद उसके बाद थैलेमस और ओमेगा और 0 पॉइंट ऐसा करते करते
हाँ
जब तक पेशेंट को रिलीफ नहीं होगा करना है राइट और लेफ्ट, फिर राइट और लेफ्ट। तो सर सवाल ये है कि जैसे पेशेंट को सिंगुलेट से नहीं हुआ तो निडल निकाल के लेफ्ट में लगाए और
नहीं,
उसके
निकाल
बाद
के नहीं लगाना है,
ऐसा
जो लगाई उसको लगे रहने देना है,
लगे रहने देना, नेक्स्ट पॉइंट पे लगाना है।
हाँ
फिर
हाँ जी जी।
और सर एक आखिरी सवाल ये था कि जो मशीन होती है सर स्टिमुलेशन की, उससे क्या उसको दे सकते हैं?
नहीं, उससे भी आप कर सकते हो, लेकिन बैटलफील्ड का सीक्वेंस ये है कि जो निडल जो पुरानी लगी है ना
जी
वो फाउंडेशन का काम करती है,
जी सर।
आगे आगे की निडल को वो सपोर्ट करती है, तो हमें पूरे के पूरे पॉइंट लगाने होंगे। तो आप मशीन से करोगे तब भी फायदा मिलेगा उसको, ऐसा कि फायदा नहीं मिलेगा, उसको मिलेगा। लेकिन मशीन करके आप सीड लगा दो, फिर आगे बढ़ जाओ, फिर मशीन करके एक सीड लगा दो, आगे बढ़ जाओ, ऐसा कर लो।
थैंक यू सर।
वेलकम। यस यस मिस्टर वर्कत जी, यस प्लीज unmute yourself, kindly unmute yourself. Okay, you have to unmute. No, kindly unmute first. Till the Barkat ji is trying to unmute, we will ask from the Begum ji. Yes, Begum ji.
Sir, good afternoon, sir.
Very good afternoon.
Sir, all this time you are telling about the battlefield in reducing the pain.
Yeah.
Right. In case of insomnia, see, immediately we can't get the reply from the patient that whether he or she is getting the sleep nicely. In that case, how to treat them, sir?
Yeah, definitely patient. In that case, we have to wait for till the second day. Till the second day, because patient will not sleep, or you can put the seats and let the calm down the patient. Keep away all the devices and mobile from the patients. Let the calm down patient. The patient will fall in the sleep in your clinic as well.
Oh, we have to apply all the 5 points or just begin it with SG or omega?
No. All the battlefield acupuncture means all the 5 points.
All the 5.
All the 5.
And expect there is.
But it all the 5 points are mandatory. Then we will tell the battlefield is complete.
Even though he gets, as you said, from the beginning, when the left is okay, the not okay, no relief, then next point. But in insomnia, it is not such case. We have to use all the 5 points and expect some positive reply from the patient.
Yes, definitely. Yeah. Yes. Okay. But for the insomnia, the patient will not give you immediate reply. Okay.
Yeah.
So what we are doing for the insomnia, we have other protocol also, that is NADA. That is also the 5-point protocol, NADA. We will also discuss the NADA protocol shortly in few days. Okay. Battlefield acupuncture is working very nicely for the painful disorder, right? But we have seen the very good result in the sleep. So I am telling you, we can use it for sleep as well.
Okay. Thank you. Thank you very much.
Welcome. Yes, Supriya ji.
Good evening, sir.
Very good evening, Supriya.
Sir, so for emotional imbalances, somebody has fear of closed spaces and fear of dark.
Yeah.
So can it be addressed, or do we have to go further and address the kidney and heart and all?
No. We have, see, when we talk about like a pain due to the emotion, so that is a part of limbic brain. Limbic brain. Okay. So the limbic brain is connected with these all types of the emotions. But right now, the battlefield acupuncture will be more useful when we are having pain. Okay. When we are having pain. Suppose someone is in the fear, then you have to go to the amygdala, memory, then hippocampus. But right now the battlefield, because see, we do not use the battlefield acupuncture for everything, because then what about other points? They might feel ignored. So always give value to other point as well, because in the ear we have many other points as well. And keep the battlefield acupuncture for physical pain and the emotional pain, and pain anywhere. keep the battlefield for that. Inflammation, pain, acute pain, chronic pain, any types of the pain. Even the pain of the rheumatoid arthritis, osteoarthritis, or the gout or the uric acid, in these all pain we can use it. Right?
Thank you.
Prakash Jain ji. जी प्रकाश जैन जी.
सर अब कोई नहीं, क्लियर हो गया, कल करेंगे ना कोर्स?
हाँ जी.
वेबिनार, फ्री वेबिनार है ना?
हाँ.
पहले आपने नेक्स्ट वीक बोला था, इसलिए मैंने आपको.
नहीं, नेक्स्ट वीक में नाडा का करना है. नाडा.
अच्छा.
अभी कल तो बैटलफील्ड चलेगा, इसके बारे में कुछ और बातें बतानी है.
कोई बात
जी.
थैंक यू.
ओके. हाँ राधिका जी, अनम्यूट योरसेल्फ. राधिका जी. पहले अनम्यूट करिएगा. Unmute, kindly unmute. Yeah.
Good evening, sir.
Very good evening. Yes.
Wonderful course, sir. I had a couple of queries.
Yeah.
First thing, senior patient applying kidney yin deficiency, getting relief in hearing as well as knee pain. The question is specifically for, you said that if I go today and apply this Battlefield protocol, can they continue applying kidney yin? Because they're doing self-application on Biol.
Yeah.
And getting good results. So that clash which you spoke about, I wanted clarification.
So we have to see if our patient is already getting relief by some other treatment, so better to continue the same treatment.
Right, sir.
Now the point number two. The point number two is this: if you want to apply the Battlefield, then apply the Battlefield in the separate sitting and the kidney in the separate sitting. We don't have to combine both the points, because both points are individually very, very effective point protocols. Okay.
It is.
Yeah. So when we talk about the old person, when we want to work for the pain and inflammation, the Battlefield is very good, because I have applied this protocol to 82 years of old lady, and she got very good relief. But when we want to work, because the kidney yin we have diagnosed very properly, and then we can go with the same, because kidney yin is also improving the health of the bone. So both if your diagnosis is already perfect and patient are getting relief, then I will suggest you continue the same. Okay.
Right,
because
sir.
Battlefield Acupuncture is working mainly for pain management and inflammation.
Pain
Right?
is mostly like somebody is sitting, they will not get pain.
Yeah.
But when they're walking and they get the weight of the body on the joints, then the knees are paining. So then
Yeah,
I
so
thought,
in that condition, you have to strengthen the conditions. So that is the age-related problem.
Yes, sir.
Related problem. So whether you can go with the kidney in only, or in the ear also, we have many other points. But I think Battlefield is not required in that condition.
Battlefield is not required. Sir,
Yeah.
I had one more doubt about the location, sir. Location of that omega-2.
Okay. So just fold the ear, reaching on the top, then just go 1 centimeter front. So
Is
reaching
that-
on the top, then going 1 centimeter front. That is omega-2.
So will that point be painful for us to locate correctly?
No, it depends. If you are having some muscular pain or the
Right.
bone pain, then it might be painful.
Right,
If you
sir.
press it. If you press it, it might be painful. Yeah.
It might be painful. That will give us a hint that that is
Yes,
omega-2.
yes,
So
yes,
irrespective of the size of the ear,
Yeah.
omega-2 is 1 centimeter
No,
ahead.
no. I am telling for the adult.
Huh.
Like I am seeing you, so I am telling for you. But
Right, sir.
according to see, if we are learning the acupuncture, then we are telling helix 1, helix 2. If in that way you will go, then ear apex is the helix 7.
Right, sir.
Then just before that, helix 6 is the omega-2.
As a helix 6 is equal to omega-2.
Yeah.
Okay. Got it.
Okay.
Got it.
Yeah.
Thank you so much, sir.
Welcome.
Thank you so much. Wonderful class. Sir. Thank you.
Thank you, sir. Sarabjit ji, yes, please. Unmute kariye, unmute.
Yes. So 3 questions I'm having.
हाँ.
So as the name suggests, Battlefield Acupuncture. Okay. तो ये जो points है ना हमारे इंजरी पर भी वर्क होंगे. Only it will work on the injury, not on any other way.
Yeah.
तो हमें ये सोचना चाहिए कि जहाँ पे इंजरी हो गई या घर पे भी कट हो गया नाइफ से, तो this point will work.
Yes, definitely. Yeah.
So
yes.
ये हमें याद रखना चाहिए कि it will work only for the injuries. है ना? और ये जो लोकेशन का है ना, यस सर, द लोकेशन नीड्स टू बी मोर एक्यूरेसी। तो
ओके,
या तो आप इसको ग्राफ पेपर में कीजिए, क्योंकि ओमेगा 2 भी
नहीं क्या होगा ना कि लोकेशन क्या होगा, लोकेशन जब तक आपको 3D नहीं दिखाएंगे आपको समझ में नहीं आएगी, क्योंकि ग्राफ इज 2D, the graphical representation is the 2-dimensional.
लेकिन
So we have to go 3-dimensional, then only we will able to search. इसलिए मैंने आपको इसीलिए उसमें दिखाया था, जो 3 dimensions मैंने आपको दिखाया था, ईयर को तोड़ मरोड़ के मतलब हमने दिखा था, उसी में हम दिखा सकते हैं वापस।
3D में भी अगर हम लोग 2D डालेंगे तो वो मोर एक्यूरेट होगा सर।
2D में क्या होगा ना कि 2D में
3D में भी 2D डालो सर।
2D कैसे समझ में आएगा?
ग्राफ वाइज में समझाओगे तो एक्यूरेट आ जाएगा सर, क्योंकि ओमेगा 2 को देखो ट्रायंगुलर फॉइजर जो वाई शेप का
ओमेगा 2 आ जाएगा, ओमेगा 2 आ जाएगा, 0.0 आ जाएगा,
और थैलेमस भी आ जाएगा
सर, लेकिन थैलेमस नहीं आएगा। थैलेमस
आएगा सर, अब थैलेमस भी आ जाएगा,
थैलेमस अंदर होता है, तो पॉइंट उसमें आएगा। उसमें लोग गलती से क्या होगा कि मैं आपको बताऊं कि कई लोगों को मैंने देखा है थैलेमस बाहर लगाते हैं, बाहर,
ओके,
उनको पता ही नहीं कि अंदर होता है वो।
नहीं, उनको जब पता चलेगा पॉइंट से नीचे जाना है हमें बैक साइड में, तो लगा देंगे ना
हाँ, तब तो इसीलिए क्या होगा
तो वो लोकेशन देना पड़ेगा, हमें एक लैंडमार्क डालना पड़ेगा सर। लैंडमार्क जरूरी है,
इसीलिए हम कहते हैं कि आप बाहर पहले पहुंच जाओ, फिर उसी का ठीक अपोजिट साइड में अंदर की ओर बिंदु है।
यस सर। और एक सर, व्हाट इज द होल्डिंग पावर बिहाइंड द स्क्रीन, हु इज मेंटेनिंग द पॉइंट, ऑल पॉइंट्स आर इन सीक्वेंस, तो कौन मेंटेन कर रहा है, हु इज द होल्डिंग पावर? डॉक्टर रिचार्ड ने दिया हुआ है कुछ, हु इज मेंटेनिंग दिस होल्डिंग?
डॉक्टर, ये जो डॉक्टर रिचार्ड्स का है ना, वो अपना ये, क्योंकि डॉक्टर रिचार्ड was doing this therapy और उनकी अपनी खोज है, वो उनकी अपनी खोज है। तो उन्होंने पहले क्या किया था कि ये होता क्या कि डॉक्टर रिचार्ड was in the army and he used to do the auricular acupuncture for 100 persons every day। तो बोलिए कि उनकी सडन खोज है। क्या होता है कि जब हम ट्रीटमेंट करते हैं ना, तो कभी कभी कुछ चीजें सडन अराइज होती हैं।
yes, yes.
Then they have kept in the sequence. So initially they have just started with the 2 points, cingulate gyrus and thalamus, just 2 point। उनका सोचना था cingulate gyrus for the emotional pain and thalamus for the outer stimulus। They have started journey only with the 2 points। Okay, उन्होंने केवल 2 पॉइंट लगाए बहुत सारे लोगों को, और उससे लोगों को अच्छा रिलीफ मिला। फिर कहीं कहीं उनको लगा नहीं, थोड़ा सा एक और पॉइंट डाल दो, मसल्स पेन का और बोन पेन का, तो उन्होंने ओमेगा 2 डाल दिया, राइट। अब ये 3 पॉइंट्स की कहानी चलती रही काफी समय तक। फिर क्या हुआ कि उनको लगा कि कई पेशेंट्स में लगा कि इनकी बॉडी का अलाइनमेंट ठीक नहीं है, तो फिर उन्होंने 0.0 भी डाल दिया, और लास्ट में उन्होंने कहा चलो एक ट्रायंकुलाइजर पॉइंट भी ऐड कर दो। तो इस तरह से उनकी खोज हुई है। दे हैव स्टार्टेड जस्ट विद द 2 पॉइंट्स फर्स्ट, एंड स्टेप बाय स्टेप उन्होंने आगे प्रोसीड किया है इस तरह से।
यस सर, थैंक यू सर।
या वेलकम। यस मैडम किरण जी, unmute yourself।
Yes, sir. Good evening, sir. Good class. I want to know, will this work also work for kidney pain, kidney stone pain?
See, we talk about the kidney inflammation, it will work, but if we talk about the kidney stone, we have to do something else। हमें किडनी स्टोन के लिए, क्योंकि किडनी स्टोन क्या होगा, वो एक तरह का आप ये समझिए कि मैकेनिकल ऑब्स्ट्रक्शन है। दैट इज अ मैकेनिकल ऑब्स्ट्रक्शन, यानी स्टोन है। स्टोन जो वॉल पर इरिटेबिलिटी और रेडनेस और इन्फ्लेमेशन पैदा करेगा, उसको ये कम कर देगा। लेकिन हमें किडनी स्टोन के लिए हमें तो सेपरेट प्रोटोकॉल बनाना पड़ेगा,
ट्रीटमेंट करना पड़ेगा।
हाँ जी बिल्कुल।
अच्छा, एक पेशेंट आया और हम लोग दोनों साइड पे,
और हमने देखा कि इसको किडनी स्टोन है इसलिए कमर में दर्द है, तो आप देखोगे कि बैटलफील्ड लगाओगे तो दर्द कम हो जाएगा, लेकिन फिर भी आपको स्टोन के लिए कुछ करना पड़ेगा।
तो मैग्नेट्स भी लगा सकते हैं हम लोग?
जी बिल्कुल लगा सकते हैं, मैग्नेट लगा सकते हैं।
और दूसरा क्वेश्चन ये था कि सपोज पहले दिन पे आया और हम लोग 2 पॉइंट्स करते हैं, ओमेगा 3 तक आते हैं और बोलते हैं 100% रिलीफ है, तो आगे कंटिन्यू करने का
ओमेगा 2 है, ओमेगा 3 नहीं है।
हाँ, ओमेगा 2 सॉरी। बाकी 2 पॉइंट्स कंटिन्यू करने का कि छोड़ देने का उस पे?
नहीं, बाकी जो पॉइंट बचे हैं वो उसी कान में लगा देना है जिससे उसको रिलीफ है।
ओके,
हाँ, वो लगाना जरूरी है, सारे पॉइंट लगाना जरूरी है,
सारे पॉइंट जरूरी है। ओके, थैंक यू सर, थैंक यू फॉर द गुड क्लास।
जी वेलकम। यस शिवशंकरन जी।
Good evening, sir. Are you having, sir, normal auricular class by this 4:30 p.m. today?
No, we don't have.
Oh, instead of this only, we have started by 3 o'clock.
Yeah.
Okay. Tomorrow also by 3 o'clock or 4:30?
No, tomorrow also same timing.
Same 3 o'clock only.
Yeah.
Oh, this is the auricular class.
Yes, yes.
Battlefield. Thank you. Thank you.
Welcome. Okay. Okay, fine. तो अभी हम हमारे कुछ स्टूडेंट्स हैं जिनको हम हिंदी में थोड़ा सा अभी हम ब्रेक कर रहे हैं 5 मिनट्स का. वी आर डूइंग द ब्रेक ऑफ 5 मिनट और उसके बाद हम थोड़ा हिंदी में रिकैप करेंगे. तो वी आर डूइंग द ब्रेक फॉर 5 मिनट, देन विल डू द रिकैप इन हिंदी. सो द पर्सन हु आर नॉट अंडरस्टैंडिंग हिंदी, दे कैन लीव नाउ. जिन लोगों को हिंदी समझ में नहीं आती है वो अभी जा सकते हैं. अब हम उसी कहानी को थोड़ा स्पीडली हिंदी में रिवाइज करेंगे 5 मिनट का ब्रेक करके. राइट? सो क्लोजिंग द सेशन नाउ. अब हम मिलेंगे. वी विल सी यू टुमारो 3 PM again. So kindly join tomorrow. We have many things new to discuss in the Battlefield Acupuncture. Okay, still it's not over. Okay. So thank you so much. Now doing the 5 minute break. Then we'll do Hindi recap.